I'm very glad to have the opportunity to present you the EU level response to cybersecurity challenges, and that's through, well, what's behind this, of course, is the fact that cyberspace as you know, is the backbone of the digital society, economic growth. We have the Digital Single Market Initiative, and this is, you can look at what I'm going to talk about now is the NIS Directive as a sort of legal regulatory framework within which actions can take place within member states, within different sectors, and between member states across the EU. And in July, the Parliament adopted the directive, which came into force in August of this year. Basically, it's a directive which is aimed at enabling the authorities within the member states to react as quickly as possible, to collaborate, as I said, with the various actors within the different critical sectors, and to work with each other. Member states will have 21 months to transpose the directive into national law, and then a further 6 months to identify the operators of essential services. So basically, the objectives here are increased national cybersecurity capabilities, cooperation, cross-border cooperation at the level of the EU, and then looking at security and notification requirements across the member states. So basically, all member states will have to have an NIS national strategy, an authority, a national authority which has the competency for NIS, and then in reality, sort of a practical implementation of this will be computer security incident response teams, which need to act within the particular member state of the region, but they need to work with each other. There will be a cooperation group, and who will be involved in that? It will be the member states, the various authorities in the member states. In the Commission, we will work on being the secretariat for that, and our colleagues in ESA will also have a very important role to play. So you can see here the tasks of the cooperation group, in information and best practices on incidents, risks. Awareness raising will be very important indeed, and we heard in the previous presentation the importance which needs to be attached to raising the awareness in different sectors. In particular, I think in the health sector, we're actually, in my previous role, I joined the cyber security unit of DG Connect a few months ago. Prior to that, I was working in the health area, and we were carrying out cooperation with the US. And one of the areas that we were working on was IT skills for the healthcare workforce. So there's a big drive on now across the member states to increase the level of IT skills, and I think now in parallel to that, I think that we need to make sure that the various health authorities, the hospitals and the clinics and all the actors within that also have a sufficient level of awareness, and those who have responsibility for security also have the level of skills that they need. So there will be policy coordination carried out as well, and there will be a report in progress every 1.5 years. I'm not going to go through this in great detail, but basically there will be a big effort, including under CEF, which is the Connecting Europe facility, to make sure that the CSIRTs, that they're at a high level of competency as is possible, but also that we have cooperation, as I was saying, across the EU. Now, not all member states is health infrastructure, IT infrastructure seen as one of the critical infrastructures which needs the highest level of protection, but I think that's one thing that we'll be working on very hard. And you can see here energy, transport, banking, but also health. And I think that the healthcare area in particular, because up until now in terms of implementation of IT, eHealth systems, there have been many disconnected islands which are now being linked to each other. And as we heard in the earlier presentation, I think the healthcare sector in particular is quite exposed. And again, you'll read, I'm sure, in the newspapers, you watch online that there is an increasing number of hacks. And now as well, health data, health information, which is the most sensitive information that one can think of, I suppose, which is stored. It's one which has got the highest financial value, which I think, which means that it'll be increasingly a target. And then security and notification requirements, for example, when it comes to the digital service providers, important ones are online marketplaces, cloud computing services, and of course search engines themselves. So we want to make sure that the member states ensure that the operators of essential services and also the digital service providers, that they adopt the correct and the highest level security attention to prevent risks, ensure that there is a proper and effective NIS strategy and implementation for each of the member states, and also if there is an incident occurring in one member state, that there's a rapid response to that and there's notification to the other member states as well. So again, we will have notification requirements again on the operators and both of essential services and the digital service providers. Now, that's just a quick overview of the NIS Directive, but in addition to that, we're also looking at, as I said, strengthening cooperation across Europe. And we want to see this in the context of the single market, of the digital single market, and we're mobilizing private and public resources under a CPPP, which is a contractual public-private partnership for implementation of the NIS, and we want to make the most of the cooperation mechanisms which will be in place. Again, our colleagues in ENISA were bringing forward the evaluation of ENISA with the aim to, I'm sure at some stage that we will have an ENISA 2 beyond, I think it is 2019, if I'm correct. Okay. certification and labeling is very important. I think that you heard about the importance of certification, which means that and the labeling aspects, and that's both for products and services. This is very important, and in fact, again, in particular in the healthcare area, for all of the actors involved, the practitioners and the patients and many others, to have the trust is very important. So certification is going to be very important. Scaling up investment in this area. In fact, they say that the cyber security sector itself will be a major source of innovation in the next 4 or 5 years. And we want to make sure that we stimulate the right kind of SMEs who can be part of providing the innovative solutions to the challenges which are faced. Again, I'm not going to go into this in too much detail, but you can see here that we have identified key areas such as automated cars, Industry 4.0, and up there with that in terms of priority is eHealth. And I just want to move on quickly to, just to say that funding is very important. I mean, again, this will be, most of the funding for implementation of the NIS will take place within the member states themselves, both public and private sector, but across the EU, we will be funding the CPPP, and that will partially come from Horizon 2020. And the main aim here is to mobilize the resources and to help to turn Europe's world-class cyber security research, and we do have quite a few centres of excellence in this area across the EU. We want to bring that forward, and the outcomes of the research, we want to make those into products and services which can be used across the EU, but also worldwide. Again, we want to make sure that we build trust among the users, businesses and the public administrations. And you see there are a range of technical and non-technical priorities, and again, education, skills and training will be very important. Within Horizon 2020, that will provide the legal framework for the establishment of the CPPP. And then we have various parts of the work programs, both the existing work program 2016-2017, and now we will have now we're in the process of drafting the work program from 2018 to 2020. And again, the area of digital security for health data will be a very important feature of that. I just thought I would end the presentation by, I showed this slide yesterday when I was specifically talking about cyber security aspects in the health area, but I just to put on the table here what some of the future challenges in the health area might be. And I think the main thrust here is the fact that the maintenance of trust in the systems, in the medical devices, in the scanning devices which are used is very important. I'm sure that those of you who are active in the health area, often the use of IT is seen as yet another task on top of the very many tasks that the practitioners have to do. But we want to make sure that we embed within the services, within the products, enough trust through effective protection, through cyber security efforts to make sure that that trust will continue well into the future. We're going to have probably what one might call more dynamic digital healthcare systems, which will require more sophisticated, more secure ways of storing the health and personal data. And again, it will be essential to guarantee the exchange. Exchange of the data itself is very important. And you might call it will be increasingly either mHealth oriented, or certainly the number of devices which will be used to acquire health information about all of us is exponentially increasing. So we have to address the security challenges of this. And in fact, we might need to go beyond the current concept of an electronic health record, which are maybe more seen as a static repository, and then we need R&D for this. So this will be a feature of the work program 2018 to 2020, and I see I have run over my time slot. But thank you very much for your attention.